Hi, how are ya? I hope you're having a great day. Today, I'll cover a few of the potential treatments talked about in the research literature. Dextromethorphan, Naltrexone, BCG Vaccine, and Metformin. These treatments are potentially positive, but only time will tell. Of course, what we all want is not just treatment, but a cure. Also, we would like treatment to get rid of our symptoms, one and done. But I guess we'll take what we can get at this point. Neuroinflammation is known to play a role in fibromyalgia. Widespread neuroinflammation in fibromyalgia and ME/CFS causes the brain to basically be on fire and on high alert, which pours out inflammatory substances that cause pain and other symptoms, and then causes the nerves to respond to every little stressor. A drug called dextromethorphan, codename DXM, is used to treat coughs. In animal studies, DXM has been shown to protect neurons from toxic levels of glutamate and low oxygen levels, and also inhibit those inflammatory producers like microglia. However, only about 37% of animal study results are successfully replicated in humans. In a small study by Mueller, Ness, and Younger that was completed in January of 2021, researchers didn't find that a low dose over 15 weeks of DXM showed any strong evidence to support this treatment. DXM is found in cough suppressants like Robitussin DM or Mucinex DM. DXM is thought to reduce pain, which in this study, it reduced pain by about 30%, which is typical of other medication that we use, but this wasn't statistically significant. These researchers suggest that considerably more research is needed before DXM is used as a viable treatment. The study wasn't a flop, but it wasn't an overwhelming success either. It's possible that a different dosage will work better, or if used with ketamine. But if too high of a dose of DXM is used, it can cause hallucinations and impaired thinking. So don't go out and buy cough syrup, I guess. Naltrexone is a drug used to treat alcohol dependence and opioid use disorder, and it's been used for over 30 years. But in a low dose, it could be a good medication for those with fibromyalgia. In fibro, it might work as an anti-inflammatory, block certain proteins that cause fibromyalgia, keep the immune system well balanced, block those receptors associated with pain, and trigger the release of endorphins. A final study on naltrexone, codename LDN, by a Denmark research group will be completed by January of 2023. I'll keep you updated on this study. Several clinical trials have been released so far. This treatment is promising, with about 60% of patients achieving over 30% improvement of pain were found at a dose of 4.5 milligrams, but a higher dose of 6 milligrams might be more beneficial. It was tolerated well by participants, And so far, only small studies have been conducted. So I look forward to the larger study of 100 participants to more generalize it to our fibro community. This is sometimes used off-label. That first study on LDN was in 2009. I thought it interesting to note that although participants showed a greater tolerance to pain and for hot temperatures, there was no effect on cold temperatures. That's a real bummer. Also, in January of 2023, another potential treatment or possible cure is the BCG vaccine. This is a vaccination that prevents tuberculosis and has been used for over 100 years. A phase 2 study is exploring whether the BCG vaccine can be an effective treatment for use in fibromyalgia. The belief is that it will increase immune signaling molecules called cytokines. They're looking at symptoms like pain, depression, anxiety, cognitive function, emotions, and overall quality of life. So that sounds pretty hopeful. And lastly, I'd like to talk about metformin. In one small study in 2019, results showed a highly significant association between fibro and HbA1c compared to controls. Insulin is a hormone produced by the pancreas, which regulates blood sugar levels. An A1C test is a blood test, which helps to monitor your blood sugar levels. Insulin resistance is a term that's not measured directly by HbA1c, but it is a marker for this abnormality. About 15 to 18% of diabetic patients also have fibromyalgia, so keeping your blood sugar levels under control is important. Diabetes, fibromyalgia, and ME/CFS share some commonalities such as problems with energy production, small fiber neuropathy, fatigue, exercise intolerance, cognitive issues, red blood cell deformity, and possible problems with microcirculation. But in that study, the use of metformin, a drug used to treat insulin resistance, participants with insulin resistance or prediabetes and fibromyalgia were treated. Metformin was found to completely resolve pain in about half of the participants. And over time, they maintained that. But this isn't the first time that insulin resistance has been studied. In 2003, high rates of fibromyalgia in diabetes were found, as I just said, and then again in 2013. So with the new 2019 study, why is it taken so long for this to actually come to our attention? Well, in this study, they used an age-adjusted format. They adjusted the HbA1c according to age, because the younger you are, normally, the better your A1C levels are. And then as we age, our levels tend to rise. So in the younger population, their A1C numbers could appear as normal. Have you had an A1C blood test? I was pre-diabetic for several years. Once I removed sugar from my diet, my results finally hit in the normal range, a high normal, but normal just the same. So it'll be interesting to see where it's at now. Well, hopefully I have given you some food for thought. I know that it gets frustrating to wait on research, to where it gets to the medical community to catch up, but hopefully we will be seeing some good things happening soon. I hope you learned something. I send you gentle hugs and support. Love you. Dextromethorphan, Naltrexone, DS. And one could have so results showed us highly an A1C test is a blood test which helps to monitor your blood. But in that study, but this isn't the so with the new to the so